Hello, my name is David Duffy. I'm a retired physician sharing healing thoughts. This is episode number 12, and we're going to talk about atherosclerotic heart disease today. When I was in medical school one summer, I worked with Dr. William Castelli, who was a researcher in heart disease. He wrote a book called The Relaxation Response and did experiments to treat hypertension by teaching a person to use biofeedback to relax. So a person with hypertension, instead of taking medicine, would totally relax in the morning and then several times a day to renew his sense of relaxation and lower the blood pressure. And that treatment was equivalent to taking a pill. He was also involved in the Framingham Heart Study. That was a project that began in the 1940s and went on for many, many years. This fact is still going on. And they took about 5,000 patients in Framingham, Massachusetts, one of the towns near Boston, and they gave them an exam, and then periodically they continued the exam, wanting to see if they developed cardiovascular disease, namely having a heart attack, angina, stroke, things like that. And they found that people who smoked, who had high blood pressure, had high cholesterol, and were obese, had a higher risk of heart disease. Exercise reduced the rate of heart disease. Now, a person has his lifestyle, he likes to eat this, he does this, and he does not feel anything for many years in terms of his heart. And then all of a sudden, he gets chest pain when he exerts himself, or he has a heart attack. So what do we know? Why does this suddenly have an attack? Well, it's been going on for a long time. It takes time to build up disease in your heart, and you don't know it until it hits you. Well, that doesn't make sense. Let's try to figure out how it works. In the course of life, the blood vessels are under pressure all the time. And there's a muscular coating and then a lining, and that lining is a thin row of cells called epithelial cells, surface cells, okay? They think that free radicals and chemicals in your blood irritate it and cause a breakdown of the cell and cause inflammation. And that inflammation, when it works, when the repair things go on, fat is deposited. Some of the repair cells are macrophages that swallow up fat. Now, what kind of fat is that? It's the kind of fat that has deteriorated. It's the kind of fat that has been oxidized. It's not usable as a fat to burn, but it's there and the body tries to hide it or throw it out, and it starts accumulating. So you start having these little plaques of fat on the surface of your artery. Right? Now, if they get big enough and they break, Then the repair team comes in and it puts scar tissue in, and that's where calcium deposits, and there's a hardening of the artery. And that hardening, as it grows, can make the artery narrow. So instead of having 100%, it goes down to 70%, 60%, 50%. And the arteries to your heart can go down very, very small amounts, and you still are functioning. A heart attack usually occurs when in this narrow artery, a blood clot forms. And that when that clot forms, it's completely blocked. The blood to the heart stops in an area of the heart. And if it's too severe, the heart muscle can die, and you get severe pain and shortness of breath and the usual symptoms of a heart attack. If there's a narrow artery and you are okay when you're relaxed and doing simple things, but if you go out for a walk, climb a hill, try to run, or do exercise that increases the demand on the heart, not enough blood can get to the heart. The muscles are deprived of oxygen, and they trigger a painful episode. And then you feel pain, you can't go on, you have to rest, you get better, you take nitroglycerin to open up the blood vessels, you feel better, and then so you can live with angina for a long time. Okay, now that's life. Sometimes bad things happen, and we do research, and then we have an explanation. Well, it's because of what? The disease. Okay, now this disease is hardening of the arteries. Not everybody has it. People with diabetes get it. People with genetics of cholesterol problems may get it. So now, what does medicine do about it? Well, it says, in order, if this is building up, we have to stop it. Okay, how are we going to stop it? Oh, okay. Well, you have a heart attack when the blood clots. Oh, do we have anything to stop the blood from clotting? Yes, aspirin. Yes, Plavix. Yes, all these medicines that inhibit platelets from clumping and clotting. Okay, so a person who might get a heart attack starts to take aspirin every day, or even Plavix, which is more expensive and perhaps, quote, safe or whatever. What else? Oh, the cholesterol is so high. What are we going to do about that? Oh, let's give you a medicine to block it. Now, we know that in the genetics of yeast and funguses, there are enzymes that we know help make cholesterol. And no, the body has enzymes to make cholesterol, but certain funguses have poisonous molecules to block the formation, that inhibit, toxins that inhibit. And that's how statin cardiac drugs were discovered. They used that, and then they designed molecules like that. So now we have many types, so that we're going to take a pill that is going to put some medicine, quote, poison in your liver to block your liver from making cholesterol. Oh, so when we take that, the cholesterol goes down. Wow, we can prevent a heart attack by reducing the cholesterol. Okay. Now, the Okay. Now, in the 1980s, at the Cleveland Clinic, there was a surgeon who saw these people getting hearts, surgeries and cancers and stuff like that. And he said, what can you do about it? And so Caldwell Esselstyn set up an experiment. And he said, okay, you have all these medicines to have cholesterol, but what can you do to reduce the cholesterol? And he liked the whole food plant-based diet. And he found that a group of patients, 18 patients, who had an average cholesterol of 256, when they eliminated meat and eggs and cheese and things like that, could get their cholesterol down to an average of 132. Yeah, 246 down to 132. And when these 18 patients had 49 cardiovascular events. When they took these 18 patients and put them on the diet, they didn't have, there was one who had an event because he went off the diet, but the others didn't. And they did a before and after cardiac cath and found that the blockage with the diet was reduced and the flow of blood into the heart increased. Okay, now we have another way of handling it. Okay, perhaps you have a family history of heart disease. You are concerned. You may get heart disease. And so you already are on a blood thinner, a platelet inhibitor, and a cholesterol medicine. Okay, now that the Plavix costs $223 a month, and the Zocor costs $290 a month. So roughly, to block the heart attack from occurring, to prevent the heart attack, you can pay $500 a month for your medicine, or maybe your insurance will pay. Okay, that's the recommendation. And don't worry, because cardiology has advanced so much. Instead of doing bypass surgery, when you get a heart attack, when you get pain, we can go in there with a cardiac cath and we can put a little stent in it. We can put a little tube in that opens up the flow of blood, and you're saved. You can keep going. We can prevent the heart attack. Oh, wow. We have some plumbing in the heart that's effective. And a cardiac cath only costs $10,000. Oh, okay. Now, does this make sense? Well, if you have insurance and everything, it sounds okay. But I'm not sure. Wait a second. If I'm going to eat meat and get cholesterol from the cow and the chicken and the, whatever, the fish, that's cholesterol coming from fish. At the same time, I'm taking a medicine to block my own body from making cholesterol. I think that my cholesterol is safer than the outside cholesterol, because you're not deep frying the fat or whatever. So, whoa. $500 a month, we're going to block our cholesterol, and that medicine can cause liver toxicity, can cause muscle aches and pains and things like that. Okay, let's do it our way. Let's change our diet in the direction of Dr. Esselstyn and apply the same principle. Okay, now we're just beginning. We don't know exactly what's going to fit. So what can we do? Let's take our current diet, okay, our current diet, and look at the sources of cholesterol. Okay, we've already eliminated shrimp, lobster, and what else? Yeah, and shrimp and lobster, whatever, and pork. Okay, but the hamburgers and the chicken, baked chicken, and the eggs and the yogurt, what are we going to do with that? Let's cut that down. Let's take our total animal protein and cut it by 25%. Is that fair enough? That's not too radical. Okay, we're going to cut our animal protein down by 25%. And what are we going to do? We're going to substitute, we're not going to deprive ourselves of protein, but we're going to substitute vegetable proteins 25%. Okay, perhaps you're already taking a cholesterol medicine. And your doctor has gotten your cholesterol down to maybe 170 with their medicine, and you're going to change the diet, and for a couple of months, follow that closely. And then when you go to the doctor the next time, he's going to do a cholesterol test, or you're going to ask to have a cholesterol test done and see if by your diet changes, it has gone down. Hopefully, if your doctor is giving you a sufficient cholesterol medicine to reduce it to a very good level, when you go on your diet, it's going to even be better, so that you might even go too low, so your doctor can cut back on the cholesterol pills. Okay, so far so good. We're getting it to budge. Are we ready to go to 50% vegetable protein diet? Okay, let's try that. And so you repeat the same thing, and you go to a 50% vegetable protein diet, animal protein 50-50. Okay, so you get the point. And we're not recommending that everybody go vegan or vegetarian or whatever like that, lacto over, whatever. That's up to you. And if you find that cutting down on the meat and substituting vegetable protein is agreeable to you and you want to go further, fine. But what we want to do is find a pattern that suits your needs. Ideally, if you can completely control it with diet and not need the medicine, fine. If you're doing the best you can and you still need the medicine, fine. Whatever works for you. Okay. Now, exercise. We want to maintain some activity so that the blood vessels are open to get the blood to the muscles. We want to be able to function. That doesn't mean necessarily a person with a heart condition is going to go jogging and run marathons and stuff like that. Just walking to the store, walking up and down a hill or something is good enough. But when we regularly do that, the work the heart does to do the walking reduces. If a person is in bad shape and they try to exert themselves, the heart has to push very hard against blood vessels that are closed. If you are driving on a highway, you can go fast. But on side streets in the city, where there's a stop sign or a stop light every couple blocks, it's stop and go, stop and go, stop and go, and you can't get there too fast. When a person is exercising regularly in a healthy way, the blood vessels that carry the blood from the heart into the muscles get wider, get more open. The body gets used to it. It adjusts, and the circulation is good, and the muscle efficiency of extracting oxygen is improved. So with the same amount of heart effort, we can do more because the blood vessel circulatory system has improved because we made an effort and trained it to do that way. Okay. Now, there are other kinds of heart disease besides atherosclerotic heart disease, heart attacks. One of them is called valvular heart disease. A person who gets rheumatic fever has a streptococcal germ that has a virus that makes an antibody, an antigen, and when your immune system attacks that antigen looks like the tissue of the heart and the joints. Excuse me. And so what happens is when you have rheumatic fever and that germ is in your system and your body makes a response, there is a wave of antibodies that attacks your heart valves and cause scar tissue. And once that heart valve is damaged, over time, it can become more hardened, more calcified, and narrower. And a narrow blood vessel is going to make it harder for the heart to pump the blood through that smaller opening, and it puts a strain on the heart. There's mitral valve disease and aortic valve disease, things like that. Another kind of heart disease has to do with the electrical sorry. Sorry. Okay, I thought there was some problem with the recording. So, okay, as we resume here. Okay, as we get older and the heart accumulates junk, it can affect the electrical wiring that causes the coordination of the heartbeat. There is a sinoatrial node that has it generates electric beat. And then that goes through the atrium to the ventricle, and it causes the heart to pump, pump, pump. When the circulation and the deposits damage the nerves, we can get heart block. So the heart slows down, the heart starts beating faster and faster and faster. And when the heart beats too fast, we don't get enough circulation and we get short of breath and may faint. In order to prevent that from happening, we need to be sensitive and listen to the signals. I had a patient who was from California, and when he lived there, he had episodes of fast heartbeat, and they thought it was his thyroid, and they cut out the fish, iodine containing food like salmon that he went in the restaurant and got. He moved to New York, and for many years, he didn't have any symptoms. He went to a restaurant and had some spaghetti with some sauce, and then got a fast heartbeat episode. What happened? He went back and said, well, what was in that? And he said, there's salmon in the flavoring. And he was very sensitive to that. So once he stopped that, it was okay. Now, normally people don't think of heart arrhythmias as an allergy or a sensitivity, but that's an example of how it is. When we're having palpitations, we need to use a cleansing diet to try to get rid of anything that's toxic, but also learn to relax, just like the relaxation response that Dr. Benson used for hypertension treatment. We need to identify what triggers episodes, what helps them go away, and live within our limits. Okay, so we've given some examples of heart disease and what to do about it. The last point I'd like to make is even if you don't have heart disease now, is it wise to make some changes in your lifestyle that could prevent those kind of things? And that's why I myself follow a plant-based whole food diet, and my cholesterol is 133 also. Okay, this concludes this discussion. Next time we will talk about congestive heart failure.